I'm Dr. Jennifer Linehan. I'm a urologic oncologist at Providence St. John's Cancer Institute, and we're going to talk a little bit about histotripsy. This is a technology that we're using to ablate tumors in liver, coming up kidney, and we're hoping to use it in maybe pancreas, adrenal, prostate, bladder, organs all over the body. We call it the Edison, a machine by HistoSonics. When I first heard about this, and I actually saw it at a conference, I was absolutely amazed. This technology kills tumors without even touching you, so to speak. So let me get a little bit more in detail about what I mean by that. So sometimes when I'm talking to patients, I tell them this is Star Wars technology because there are no cuts, there's no poking, there's nothing that's going inside you from outside. It's all happening with a focused beam of ultrasound to destroy the tumors. And one of the real unmet needs of this technology was patients that had metastatic tumors. Sometimes these patients are not surgical candidates, or maybe they're trying to have a systemic therapy, like a chemotherapy or an immunotherapy, and they may not be ready for radiation. But you can use this technology to treat the tumors because it's not going to interrupt the current therapy they're on. Or you may have patients that have tumors that are in places that are close to major blood vessels that might be surgically difficult to remove or may not be shrinking with their therapy, that you can use this technology to go after. And again, because it's a non-invasive technology, this is its real benefit. If you have patients with multiple areas of tumor, if you have patients with metastatic cancer, this treatment gives these patients options. It takes their MRI, it fuses it with the ultrasound technology. So that's one way we can locate where the tumor is. We then focus the beam within that certain area. And then when you're actually doing the treatment, it won't go outside that particular spot. So one of the unique things about histotripsy, we suspect, that also does happen with radiation is it creates what we call an abscopal effect, where because it causes inflammation in that area where you've treated the tumor, it makes, we believe, immunotherapies, sometimes even chemotherapies, work better because the cells and the body is already inflamed, so it's calling all the cells to this area to either fix and or destroy what is not right. And that's called the abscopal effect. And we do see that with radiation, but I think that's gonna be a very interesting thing we're gonna look at with histotripsy, because in some of the preliminary studies they did with liver, when the patients were treated with the histotripsy, they got a better response out of their immunotherapy. And right now, again, the technology is only approved for liver, but one of the things we're very excited about at St. John's Cancer Institute is forming protocols where we can study this technology and use it for patients that have tumors in their kidney, in their pancreas, in their prostate, and their bladder. So a lot of times patients will ask me, okay, if it's non-invasive, what's really involved in the treatment? So you do have to do the treatment in an operating room or in an interventional radiology suite. You do have to undergo general anesthesia. Patients ask me that all the time, and the reason is that you have to lay perfectly still. And so the treatment can take anywhere from 1 hour to 2 hours, even up to 4 hours. They may have 3 or 4 tumors on the liver. So if you're gonna treat that many tumors, the procedure may take longer. If you may be only treating 1 tumor, the procedure will be shorter. So you have the treatment, you do have to have an anesthetic. All patients go home the same day, and then we'll repeat the scans so that we can see that the tumors have been what we call ablated or destroyed in a sense. So again, this is a non-invasive treatment It simply uses ultrasound technology. The ultrasound sort of does put a little bit of pressure on the abdomen, but there's really no burns and very minimal complications at this point because of the way the technology is distributed, because it's using a bubble cloud instead of either heat to destroy a tumor or cold to destroy a tumor. It really protects the tissues around it. So we can even destroy tumors that are right next to a major blood vessel, and it won't harm the blood vessel because you're not using a heat or cold distributed technology. So for histotripsy and patients who are interested in histotripsy at St. John's, we are offering a comprehensive team, a multidisciplinary team that's made up of urologic oncologists, liver specialists, interventional radiologists, surgical oncologists, and medical oncologists, who all will be helping to look at these cases, decide which patients are best candidates for histotripsy. And why it takes so many disciplines is because it's understanding the nature of these cancers. These are complicated cases, especially because these patients have had multiple treatments. And so, when you have a patient with a liver tumor, a kidney tumor, a pancreas tumor, an adrenal tumor, is this because of metastatic disease? Are these because of cancers that originated in those organs? Is it from another cancer that spread there? So we have to understand the different types of cancers. We have to understand the different types of treatments these patients had, which is why the medical oncologist is important, immunotherapy versus chemo, how that's gonna have the patient react to these treatments. We have to have the radiologist to understand where the tumors are. Are they in a good position to have histotripsy? A urologic oncologist like myself understands the kidney cancers. We have a endocrine surgeon who understands adrenal tumors, a liver surgeon who understands liver tumors. So it's important to have all these different specialties combined to be able to provide patients that want to use this technology with the best care. At Providence St. John's Cancer Institute, we will have a clinical trial here. Right now, again, the histotripsy is only approved for liver. Kidney is probably coming in the next 6 to 8 months, but we've written a protocol so that patients who may not have any other options may have a chance at doing histotripsy, and it may treat their cancers. But it has a lot of potential. How do we forward that thinking into other organs besides just the liver? And what organs that treatment may be best in? This technology has served an unmet need, especially for patients with metastatic cancer, which, as anyone could understand, some of these patients have failed chemotherapies, immunotherapies, and now we have this treatment that's available for them where they didn't before. In some patients, they may have had radiation before and they can't have radiation again, and now they have this technology that's available to them. And this was really a part of the generosity of our foundation and the Reardon Foundation, with Elizabeth Reardon, who's part of our hospital here, seeing this as such a high need demand for these patients that they put together funding so that St. John's could get this technology and forward this technology, throughout our system and throughout Providence. And we're really grateful to them.